Welcome to the We Talk Health Podcast, the official podcast for West Tennessee Healthcare. Please be advised that this podcast is not intended to replace any medical advice. Always follow your medical professional's advice and direction. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions, please reach out to us at wetalkhealthpodcast@gmail.com, and we will do our best to answer any questions you may have.
Welcome to another episode of We Talk Health. My name is Kwasigroh, and joining me in the studio today again is Miss Ruby Kirby. She is the CEO of Bolivar Hospital, which is what we'll be talking about today. Miss Kirby, how are you?
I'm good, and how are you today?
I am doing great. Thanks for coming in again. This year is the 71st. I didn't mention this in the other podcast, but this is the 71st year of West Tennessee healthcare being a thing. I'm interviewing all the CEOs of each hospital to learn more about the hospitals that they are over. Ms. Kirby, like I said, she is at the Bolivar Hospital in Bolivar, Tennessee. So could you tell us how long you've been with the West Tennessee healthcare system and how long you've been at Bolivar?
Okay. So I've been with West Tennessee Healthcare to be 42 years in October.
That's amazing, 42 years.
And I have been at Bolivar now 22 years. January the 7th, 2022. It'll be 22 years.
You've been there for a while. That's amazing. So you're very well versed in all things Bolivar. That's great.
Yeah.
So how many beds are offered at Bolivar Hospital?
Bolivar Hospital is a critical access hospital, and we are licensed for 25 beds. And, the other services that we have in our 25 beds, we run about an average daily census with swing bed and inpatient is about 5 patients a day.
Okay.
And in the emergency room, we see about 32 to 35 patients a day.
Gotcha.
So we see almost 10,000 patients a year coming through the emergency room.
Gotcha. You said a term a minute ago that I've heard, but I'm not fully understanding of what it is. You said a swing bed?
Swing bed.
So what does that mean?
Yes, so swing beds, and a lot of people think it's beds that swing in the air. What it actually is a category of patients that we can admit into the hospital, much like nursing homes.
Okay.
So we see patients that need short-term rehabilitation or some type of care. They do not stay as long as they do in a nursing home. Our average length of stay is about a month. It could be someone that fractured a hip and need physical therapy, and they come and we do inpatient PT with them. IV therapy, if they have to have long-term IV therapy, we do that. So it's those patients that need inpatient care, but for a shorter term than if they went to a nursing home.
Okay. So what all services are offered at Bolivar Hospital?
At Bolivar, like I said, we have inpatient and outpatient services as well as our swing bed. We also have radiology, which our radiology department does mammograms, diagnostic, x-rays, CAT scans, ultrasounds. Those are the services that we provide there. We also have respiratory therapy. They see patients, inpatient and outpatients. We do Holter monitors for outpatients, EKG. We have PT, rehab.
Okay.
See both inpatient and outpatient. We actually have a cardiac rehab in Bolivar.
Oh, that's amazing.
So we are seeing quite a few cardiac rehab patients. Those are the patients that have heart conditions that need also physical rehab. They come in and we see those patients. We have a sleep lab that does both inpatient and outpatient sleep studies. We have a dietitian that does outpatient counseling, nutritional counseling for patients that come in. Those are primarily our main topics and main services that we provide.
That's great. So why should the people in the Bolivar area choose Bolivar Hospital as opposed to traveling to other places?
Much like Camden, which is another rural hospital, our staff in Bolivar, the team is primarily from Bolivar or the surrounding counties. Average tenure of the staff at Bolivar is about 20 years. So they are dedicated to the hospital and keeping it open. What staff is going to tell you, we go to church with these people. We see them at Walmart. Many of them are our family. So when they come in, they're going to go above and beyond to take care of the patients that come in.
Absolutely.
They are going to give you excellent services. Our physicians are well qualified. We have a hospitalist program that we have a physician available 24 hours a day, 7 days a week. So if you have anything that comes up while you're in our hospital, is someone available to see you then. And our hospitalist actually also has an office practice right beside the hospital. So if he needs to follow you up post-discharge and you don't have a physician, he's going to see you in the clinic when you're discharged from our hospital.
Oh, that's great.
So, Bolivar, many of the staff says, this is our hospital. That's the way they feel about it. It's their hospital, so they're going to do whatever they have to take care of you. And if we can't provide the service, we're going to transfer you to the next level of care that can and make sure that you get there.
That's great. So where is the hospital located in Bolivar?
Bolivar is located at 650 Knuckolls Road, right there in Bolivar, Tennessee. So, it's right in town.
Right.
Almost.
I've traveled there several times, and it's not hard to get to at all. You do like 2 turns, and yeah. That's great. I'll link that address in the bottom of the description. So if you're listening and you want to find out where it is, you can look there and you can find it there.
As I said, I've been in Bolivar for 22 years, and that's one of the most dedicated staff to a community. Not only do they work at the hospital, but they're involved in a lot of community activity. Outside of the hospital, we work with city and county leaders to assess what the community needs. And we try to add services in. That's why we have the cardiac rehab. We just opened it about 3 months ago, and what was happening is we had so many patients that were referred to cardiac rehab that were not coming. So the staff came to us and said, we need to do this. I know somebody that needs it, and they can't go to Jackson. So while they're in church, they're at school, they're in the community, they're going to be looking to see what the community needs. During COVID, they were dedicated. Sometimes we didn't have enough staff, but they are going to make sure that the hospital is covered, so we keep serving the patients. We have staff that drives in from Mississippi. That has been working there for years because they are dedicated to that community, the patients that they're serving. And many of the community know everybody by name. So they're always positive. We, too, do not have a lot of hospital-acquired conditions. Ours actually has been 0 for the last 6 years. We have not had a major fall, skin breakdown. We have nursing assistant. And they're going to make the patient feel like family.
Good.
We received a letter about a week ago of a patient family that was there in swing bed. And, one of the things they said, they were concerned because their mother had dementia. The comment was, everybody took time to make sure she understood what they were going to do, and they treated her like their mother. That's
amazing.
That's what we look for.
To be honest, that's kind of a rare quality, I think. Not just in healthcare, just in the world itself. Is like, I'm going to take care of my own, and I'm going to get mine. But it's amazing that the hospital, the people who are dedicated to working there, treat everyone that comes through like their family.
They're going to treat them like family.
That's amazing. Yeah. Well, Miss Ruby, this has been great. Like I said, if you're looking for the address, it's going to be in the description of the podcast.
Camden or Bolivar, come down to see us. You will be amazed at what we can do.
That's amazing. Thank you so much for coming in today. It's been great sitting down and talking with you about Camden and Bolivar today.
Thank you.
Yes, ma'am. And this has been another episode of We Talk Health.